Hello and welcome to the fourth learning video of the Building Trust and Empathy around COVID-19 training module for healthcare workers. In this session, you will be learning about presumptive communication, what it is, and how it works. Presumptive communication is a style in which COVID-19 vaccination is initiated, presuming the individual will be vaccinated. In presumptive styles of communication, the provider initiates the topic of vaccination, presuming the patient will be vaccinated at the visit. Although it may seem awkward at first to use the presumptive style when it comes to vaccine conversations, this style mimics the communication used for introduction of many medical treatments, where the provider assumes that the patient wants evidence-based care, like in the case of HIV counseling and testing. Similar to provider-initiated HIV testing services, providers may discuss getting vaccinated for COVID-19 as the assumed default or normative behavior. Examples of presumptive communication include: you need to get tested today if you have symptoms of COVID-19, or you need to get vaccinated for COVID-19 today to protect you, your family, friends, and the community around you. Do you have any questions? This is in contrast to the more participatory style. So, are you thinking about getting tested? Or have you thought about the shots your child needs today? Which asks for the client's participation, but may also invite doubt into the discussion. As a result, it's better to start explaining that the vaccine can be given today, even if the patient has come for other reasons. You could say, "Hello, it is great to see you. Today we'll be doing general checkup and we'll give you the COVID-19 vaccine. Do you have any questions?" This communication style helps to create a norm around receiving the COVID-19 vaccination, and it's more likely to lead to uptake. It also indicates your strong recommendation for the vaccine. If the patient has questions or concerns about the proposed vaccination, after the presumptive style is initially used, then the discussion moves into the second stage of discussion, where you want to switch communication styles to make sure that you address their concerns with facts and pivot away from any rumors to keep focus on the disease and health issue at hand. Vaccines are a routine part of prenatal care. Women who are pregnant, breastfeeding, or want to become pregnant can be safely vaccinated against COVID-19. Let's use the scenario of a pregnant woman at the health facility to demonstrate listening skills to understand the patient's underlying concerns.
My next client is pregnant and needs my help in deciding whether or not to get the COVID-19 vaccine. Let's talk about COVID-19 vaccination. Do you have any questions or concerns?
Yes, please. See, how can they possibly know that the vaccine is safe for pregnant people?
When you are pregnant, it feels like everything is a risk, doesn't it?
Yes, so...
But I think I can make you feel better about the decision. I do recommend you get the vaccine.
Okay, but... See, this vaccine is so new. I don't want to risk a miscarriage or the vaccine affecting my baby's genes somehow.
Of course you want to be careful. There are a couple of things you want to think about when it comes to risk though.
Okay.
All the vaccines were tested with tens of thousands of women.
Oh, really?
Yes. They have also tracked thousands of women who received the vaccine while pregnant, and there was no increase in anything worrisome for moms or the babies.
Oh, I see. Okay.
The World Health Organization and Nigeria Center for Disease Control also recommend that all pregnant women get the vaccine.
Okay.
What I worry about is you getting COVID-19. Pregnant people who get COVID are more likely to end up in intensive care or have a preterm birth.
Are you serious?
Yes. I know our COVID rates are low, but it is still out there. and you and your baby are still unprotected.
Okay, will the vaccine protect my baby too?
Yes, there is evidence that once you are protected, you pass on to your baby too.
Oh, really?
Yes, if you breastfeed, you can pass protection on to your baby that way.
Oh, wow. Okay. Okay, then. I guess that's the best choice then.
Great. I will direct you to the unit where you'll be given the vaccine immediately.
Thank you so much.
There is a lot of misinformation about vaccination during pregnancy out there. It can be hard for pregnant people to know what is right. That's why providing accurate information is important. Since my client trusts me, she can trust my information. It's also important that I provide a really clear recommendation that she gets vaccinated.
Now that we have seen these communication skills put into practice, let's think a bit more about the scenario. What did the healthcare worker say or do that was positive? What did the healthcare worker say or do that could be improved? How would you respond if you were the healthcare worker in question? In summary, even in practicing presumptive communication, in which you assume the client's intention to get vaccinated, it's important to listen, to understand the underlying concerns the clients may have. Convey empathy to build trust, as the health worker did in the scenario when she acknowledged how everything feels risky when pregnant. Focus on the disease, provide accurate information, and end with a plan or clear recommendations for next steps.